I would like to introduce myself to you. My name is Karina Fuentes Medrano. I'm a psychologist graduate from the National Autonomous University of Mexico. I work as a teacher and also outsourced through Interpolyglot, a project that I started with full intention to raising questions and spreading knowledge about behavioral sciences. As a You may have seen I am currently promoting yearbook behavior modification and applied settings, which
Thank
was the
you.
first book I read during my studies. Yeah. Well, I would like to express my deepest gratitude for your time and willingness to conduct this interview.
It's a pleasure and an honor.
Thanks. Okay, so let's start. First, welcome to this exclusive interview with Dr. Alan Kazdin, a renowned expert in child psychology and parenting, starting professor emeritus of psychology and child psychiatry at Yale University, and creator of the widely recognized Kazdin method for effective parenting. Today, August 28, 2025, I have the privilege of speaking with him from Interpolyglot, where we'll explore his fascinating career, his valuable contributions to behavioral psychology, and his vision for the future to this field. I'm very excited about this opportunity and grateful to Dr. Kazim for his time. Let's begin by learning more about his early days first. So to start, I like to hear about your beginnings. Could you share a bit about your early career trajectory? What inspired you to dedicate yourself to psychology, particularly in the field of child psychology and behavior?
Well, it all began as an undergraduate. I met a professor that my friends told me was just like me and that I should take a course from him. And I took a course from him. And we ended up working closely together throughout my undergraduate career. Before meeting him, I was a language major. And after meeting him now in my college now, I majored in philosophy and psychology. I spent a lot of time with him, and he was a clinical psychologist and involved in all kinds of activities. And I realized that for my career, philosophy didn't help too much. There weren't too many options, but psychology had many options. So I decided to go into psychology. And I went to the same grad school that he did, and my career there started. In graduate school, I took a job facility for people who are emotionally disturbed and mentally retarded. And I was interested in behavior change. And I went there, and the director said to me, "Can you change behavior? We want you to change behavior of our clients." I said, "I know nothing. I'm a graduate student." And he said, "We have everyone here who's an expert, but no one can change behavior." He walked me very far in the building. He said, "Here's your office. Sit here, learn what you need to learn. And when you're ready, come out of your office and change behavior." So I spent months writing people, talking, whatever. And then I started the behavior change programs. And that's when I really got started on actually changing behavior of people who needed help. Someone heard about this who was a superintendent of schools. And he invited me to come to the schools to help with problems there. And I just kept getting more opportunities to consult with populations that needed behavior change. And so that's how it all unfolded.
So I imagine this experience has certainly marked your professional path, fed your curiosity about development of your work, and continue with your early years. What key experiences in your university or initial studies helped shape your approach to behavioral psychology and child behavior?
In those days of my graduate school, probably before the pyramids were built, I don't know, a long time ago. In those early days, there was an emphasis now on behavioral psychology and behavioral therapies. Traditional therapies weren't usually evaluated very well, and now there's a great emphasis on better research and behavioral techniques. So that was the atmosphere of my graduate school. So that influenced me a lot. And then this job, I continued as a graduate student, and then I worked in the schools. And in all of that work, there was some accountability. That is to say, the people didn't want my views to understand clinical problems. They didn't want me to give different theories. They wanted to say, can you change behavior now? We have a problem. And so my entire career started out with this accountability that don't just talk. What can you do to actually change human behavior? And that made me have this focus even still today.
Just as past experiences were key, your academic training has been fundamental. How did your doctoral studies at Northwestern University in the 1970 influence the development of your initial ideas on behavior modification and parenting training?
Well, I worked in this facility, and every once in a while, we work with the parents to help change the children or the adolescents. So it started there. And then when I started an early career, I started working with teachers in the schools, many different schools, and they too wanted help in changing behavior. So these early years was just constantly different populations and what could be done to change behavior. And in grad school, though, I worked on various research projects of other grad students, in addition to my own projects now and studies on behavioral techniques. And so grad school gave me studies, experiences, clinical training, all in behavioral techniques. So that helped a lot.
I strongly noticed that one characteristic of your career has been being self-taught and nourished by professors, colleagues, observations, and constant independent learning. Following that line, I imagine that you face various challenges at the beginning of your career at Yale. What were the first challenges you faced in directing the Yale Parenting Center, and how did this shape your early professional trajectory?
So it all began before Yale. I was in a medical school at the University of Pittsburgh, and I was asked to be in charge of an inpatient service for young children who were very severely disturbed. This was 5 to 12-year-old children who referred because their depression was very serious, or they had serious conduct problems, aggression and antisocial behavior. And those children were brought to the hospital either on a gurney by an ambulance or on a gurney by the police officers. So it was very intensive experiences. And we had doctors and nurses of every profession, child psychiatrists, everybody. And we said, how do we change these children with conduct problems? And there was no medication and no other techniques. So we decided we're going to devote all of our time to developing treatments for children. And that's where this started in Pittsburgh. We developed 2 treatments, one who had parents with whom we could work, and another just for children only, because we couldn't work with their parents. Their parents were either in prison, prostitutes, drug addicts, or we would take the child away from the parents. So we developed these 2 treatments. So after 10 years of doing this, I moved to outpatient there. So coming to Yale was not a great challenge because I moved the clinic from Pittsburgh to Yale. And we called it the Yale Child Conduct Clinic. After a few years, well, I mentioned this, I have done a lot of media work. That is to say, during the week, almost every week, for about 20, 30 years, I would do 2, 4, 5 hours of work with TV, radio, magazines, and all these things, just to disseminate knowledge. Well, the good part of that was disseminate knowledge. The bad part of that was, after a while, people from all over the world started writing the clinic and saying, you can get children to stop setting fires or beating up their peers, or you can get children to stop swearing or having tantrums, or destroying things. Can you get my child to eat vegetables? Can you get my teenage daughter to stop swearing at me when I said, how was school today? And so we changed, and then we changed our name from Child Conduct Clinic to Yale Parenting Center. And now we did two kinds of work. Children who are very disturbed, serious, aggressive, and antisocial behavior, we continued that. And then we said, we'll help parents with the routine challenges of everyday life. And so we started doing that. And people from all over the world in individual sessions would turn on their computer, and we have a session in Luxembourg, Peru, Hawaii, Venezuela, Canada, all over. We couldn't keep up the pace. We couldn't keep up the pace. So we had to stop that. But after a while, there got to be a great demand for what we did. So that not being able to continue made me provide many resources for parents.
I think that your work in behavioral education and parent training is widely recognized. Can you explain the key principles of the Kazdin method and how it is based on behavioral psychology to help children with oppositional or aggressive behaviors?
First of all, a little story you might like. When one writes a textbook, one has complete control over the title and many parts of the book. When one writes a book for the public, a trade book, one has less control. So, for example, when it came to the title of the book, the publisher said, the name of your book is going to be The Kazdin Method for Parenting the Defiant Child. I said, you don't know me, but I don't want this. There is no such thing as the Kazdin method. I have relied on research over the years. We've made some changes. There's a whole research body of this. It's not the Kazdin method. So the publisher said, we're calling the book the Kazdin method. Okay, so the score is publisher 1, Alan 0. Then I went and said, the book has for the defiant child. In the mental health professions, we never use defiant child or schizophrenic patient. We don't use those anymore because we want to emphasize that the person has these characteristics, but it doesn't define them. So the real term that we're going to use in psychology, psychiatry, social work would be the child with defiant behavior. And the publisher says, oh, that's good to hear. That's nice to hear. We're going to call the book The Defiant Child. Publisher 2, Alan, nothing. So I want to just tell you that because I'm not interested in having anything named after me. Nothing. Yes, a building at UNAM would be very nice, but other than that, nothing. And so on to the method. So the Kazdin method, so-called, emphasizes three important parts, and they're all filled with research. One is what comes before behavior, called antecedents, how you want to craft and shape the behavior itself, and what comes after behavior, the consequences. And one of the problems is many people who just look at this think, oh, this is a reward program. No, definitely not. The rewards are consequences, one part of it. And if you don't have the other parts, the program should fail. So we change behavior by focusing on what comes before, what comes during, and what comes after. And there are many things in there. And I could give you a brief demonstration if we had time on how to combine those, let's say to get rid of a tantrum, which is something, if you're interested, I could show you where the antecedents are, but perhaps we don't have time for that.
And in your books, you highlight the use of positive reinforcement, and it works like the Kazdin method for parenting to define child and the everyday parenting toolkit. You emphasize the ABCs. What
Absolutely.
are some common mistakes parents make when applying reinforcements, and how can they be avoided?
Well, the most common one is to provide a reward as some incentive right now to get someone's behavior. So if you get dressed right now, oh, well, I'll give you this. And the key concept is not reward. The overall concept of the entire approach is practice, practicing the behavior. And the antecedents and the consequences are only designed to get to continued practice, because continued practice builds habit and changes the brain. So the parents sometimes focus on this one time. If you get a good grade today in your exam, I'll take you out for ice cream. That's horrible from the standpoint of behavior change. So one thing is relying on rewards and not building habits. Another problem is people often demand too much behavior. I know the child can do it, so I'm going to wait for him to do it. No, no, no. You gradually get more and more behavior until you get all the behavior you want. So getting parents to be gradual, shaping, as it's called, is very difficult without training them. And praise is the main reinforcer that we use. And parents, most of the parents think they're great at that. And normally they're horrible at it. And the reason is this: to change for praise in everyday life, do whatever you want. But to change behavior, praise with the child has to have three components. It should be effusive. That's great. Parents think they can do that. They don't. We have to train them. Then you say exactly what it was. This time you did that and that and that. That was great. And then you do something nonverbal, like you pat the child's head or you touch or whatever. And those three components have to be practiced. And we bring parents to the session and we practice them endlessly to build habits in them. We shape, we model, we praise them until they get it down. And so the last thing about a parent myth and problem in everyday life is that punishment is going to help change behavior. Punishment rarely changes behavior. It momentarily suppresses behavior, but the research shows the behavior comes right back at the same level. So what parents do is they make it more intense. Instead of shouting, I'm going to hit you or shake you. And that doesn't work any better, the research shows. So I'm going to make it even more intense. I'm now going to really abuse. And that doesn't change behavior either. So the issue is to reorient our thinking. That is, we don't want to suppress behavior, we want to develop behaviors. And what makes it challenging is the brain focuses on negative naturally. So we have to get parents to reorient them. So those are the main challenges of parenting. And we train the parents extensively to overcome all that.
I find that is very valuable how you explain common mistakes about behavior change, especially that the punishment doesn't create lasting habits, and the importance of repeated practice to develop pro-social behaviors in children.
It's worth mentioning in here a related problem, myth. There's a frustration that we, as humans, we all suffer. And that is this: if the other person knows what we want or knows how to do something, it means they're going to do it. So in parenting, a common phrase is, if I've told you once, I've told you 1,000 times. In a relationship with one's partner, husband partner, same thing occurs. Dear, you know that I hate when you do that, and you still do that. Well, a psychologist would know that's normal.
Yeah, I'm sorry. I have some problems with my internet connection, but thank you. Can you continue, please?
A major myth in human interaction is that if a person knows something, they're going to do it. Almost everyone who smokes cigarettes knows it's horrible. Most people know that it's really good to have spinach and broccoli. Don't answer this rhetorical question. When's the last time you had spinach and broccoli? Don't answer. Don't answer. But that's the issue. Knowing is important sometimes, but it's not really heavily related to doing. So what we focus on is getting parents and children to do things, to build habits. Once we get doing, we know from other research it changes.
Yeah, I'm so sorry.
Una entrevista contigo es muy divertido.
Thank you. Sorry. Ready. I think that we're going to continue.
Lo-
That's fine. Can you hear me? Okay. I think that I have some problems with my internet, so I'm so sorry, doctor.
lo
Okay.
tomo total personalmente, pero no guardo rencor más de 2 o 3 años.
Okay. I'm sorry. Okay, I think that we can continue. And the next question, it's about ethology. Okay, the question say, your research covers diverse fields, and how does your work on the social behaviors in children relate to areas like ethology? For example, have you incorporate perspectives on animal behaviors or innate instincts into your models of human intervention?
So there are 2 parts. The animal research is very much part of this program, but you have a very interesting word. What is in the perspective I have, or what's in the model? So I return to what has guided my work. The issue is not perspective and not theory and not model. Here's been the challenge of my career. You have a child who's very aggressive, who destroys things, who has been hospitalized and in therapy and nothing works. So the question is, for me, what do we know in any field, in any discipline, anywhere that has evidence that we can change that behavior, and what are those procedures? So for me, as horrible as it may sound, I don't want perspectives. I don't want a model. I don't want to integrate something in which everyone nods yes and says, that's very interesting. That makes sense. I don't need that. I have someone in front of me right now with a serious problem. Where do I turn? Well, behavior analysis gives some of those answers empirically, and I can test them, and they work. And if someone comes along and says, ethology has a better approach, here's what to do, I have no devotion or allegiance to the Kazdin method. My challenge is to change human behavior. I don't care who has the answer. If it's a better answer from ethology. Right now, ethology and physiology and genetics and epigenetics and nanotechnology and artificial intelligence do not hand me a better way. And I can say to those people, by the way, we can take the most aggressive children. They set fires, they run away from home, they beat up teachers, they beat up a principal once in a while, and we can change their behavior most of the time. If you have something better, I'll take it. Tell me what it is. So perspectives and models, the abstractions are wonderful, but when you're on the battlefield and you've got to fire a gun at the enemy, you don't want to understand the nature of weapons. You've got to solve a problem. And so my situation from graduate school to now has been, how do you fix this? And so I don't include lots of things in the model. And that may be I'm not much of a scholar, but when I need to change behavior, I know where to go, where the evidence is.
Thank you, Dr. Kazdin. I have seen some comments where people say only ethologists do research with animals. So thank you so much to clarify it. But your point about this difference is arranged. Now, I'm sorry, this word is too difficult to me. Psychophysiology is another interesting aspect that you mentioned. Have you explored how biological factors such as stress or emotional regulation influence child behavior disorders, and what implications this has for interventions?
So we focused a lot on stress because the parents who come to us are horribly stressed. Many of them, the child alone is a source of stress, but many of them have very difficult lives. A large number of them have a psychiatric disorder. Many of them are unemployed. Many of them are involved in drugs and prostitution and prison and all kinds of other things. And so we have dealt with stress. Plus, the research on stress shows that parents who are stressed punish more harshly and tend to foster, to promote, accidentally promote more deviant child behavior. So we've had added the stress component to our program in which we help the parent manage stress. And when we do that, the treatment works even a little better for a stressed parent. Another part of psychology that we work on is cognitive processes. Our other treatment is cognitive problem-solving skills training. We only work with the child there because the child has no parent with whom we could work. But in terms of physiology, we know a lot. There's a genetic component to virtually all psychiatric disorders, including conduct disorder, even suicidality. Physiology is very important. We know that the reactions of people with conduct disorder, many of whom are also attention deficit disorder, have different brain profiles. But I go back to my question. All that is important and it's wonderful. Tell me, I ask you now, tell me from what literature should I draw to help me change this child right now who is trying to suffocate his sibling? What do I do now with this child who's putting pets in the oven? Tell me what I should do from physiology and genetics. Now tell me. I'm open. I do not have the answer. I have an answer and evidence to show that I can change behavior. But tell me, I'll take any religion. I'll take any discipline, any food. Tell me, and I'll do it if you have evidence that it makes a difference. Think of the challenge. You think of the challenge. You have this classroom. What can you do in this classroom of all deviant child behavior and the teacher doesn't know what to do? What are you going to do? Physiology? Give a perspective to the teacher? Tell the teacher your model? Well, here's your problem. I have a model. And in this model, there's a genetic component and there's a physiological component, and they all converge together, drawing upon ethology. And the teacher says, could I have another psychologist, please? This person can't help me at all.
Yeah, very clarifying, Dr. Kazdin. Yeah. Moving forward, I would like to address the future of psychology as former president of the American Psychological Association. What were your main initiatives to address social challenges with like personal violence and access to mental health treatments, and how do they apply today in the future of psychology?
Well, presidents of the association have money and to prioritize things that they care about. And so they have these initiatives. And what you do is you assemble expert groups and you decide what you're going to do and have these groups help you. So I took three. What can psychology say about global challenges, such as climate change? And there's a lot there. And what can psychology offer for treatment of post-traumatic stress disorder? There's a lot there. And what can psychology say about interpersonal violence? So what a president does is has these reports and various meetings and a conference, but basically these are all lost because the next president comes along and she or he says that I have three initiatives. And this goes on and they all get lost. However, in my case, two colleagues became very interested in interpersonal violence, and they start a national organization. And that organization promotes anti-violence and has all sorts of conferences and meetings and think tanks. And that's still going on without me. I'm not involved. So I was fortunate that two people who were part of the initiative wanted to start something national. And so that continued. But more often than not, these initiatives don't continue. It's disappointing. We want them to.
Okay, I'll make a short pause here to tell our followers that I will put the organization's links in the screen of this video or in the description.
That would be very nice.
And continue with the future in your research on depression and disorders in children. What recent advances have you seen in treatment? And how do you believe this will evolve in the future of child psychology?
Well, this may surprise you a little bit, may disappoint you a lot. So after 35 years of developing these trends, we spent millions of dollars and we developed two effective treatments. They're effective. We replicated, other people replicated. I was very satisfied that the treatments we have work. And we provided them to people with children who had serious problems and people who wanted help with the routine challenges. So everything was going well. From a career standpoint, one could say things were going well. From the standpoint of your question and the world, it wasn't going well at all. And the reason is this. I started to realize that a few things are going on in the world. One of them is among children, adolescents, adults, and old individuals, psychiatric diagnoses around the world, disorders are on the rise. They're increasing. That's one thing. Second one, the vast majority of people in need of mental health services in Mexico, the United States, and around the world receive nothing. Nothing. And the small group that receives something, most of them get a treatment that's not evidence-based. So I thought to myself, what am I doing? Why am I doing this? We're working on a treatment that nobody gets. That isn't what I want to do. This is not about a career. This is solving a problem. And so I decided I don't want to work that way anymore. So I stopped that treatment research. I helped get jobs for my people who are working with me. And I decided to switch fields to enter psychiatric epidemiology. And that work now is dealing with world mental health, how to get treatments to large numbers of people, not my little treatments that go nowhere. And yes, it's nice to have a Kazdin method. For what? If it's not getting to people, it's like having a cure for cancer, but it's only used in your home. No one else gets it. So now, the future, I'm trying to get psychology to do more toward public health. And my own work now is collaborative, working on how to scale up treatments, perhaps technology, digital treatments, to reach many, many people in need. And so I'm working on various treatment options that are much more disseminable than the treatments that psychologists and psychiatrists have developed in their evidence-based treatment programs. It's a big change.
Without a doubt, I share the problem is access to effective treatments that exist but often don't reach the people who need them. To close this section, could you tell us about any current or future project you are working on, perhaps related to the gap in access to mental health treatments or innovations in parenting, and your vision of how it will impact the future of the discipline?
So there are a couple things about the future that I'm looking at. I have a number of projects now with digital treatments to extend to around the world in collaboration with others. I'm not the main person, I'm just a larger team. And so we're trying that in different places around the world. But there's something else I've been looking at. I mentioned to you about my question, the guiding question for me. The guiding question for me is what can be done to change human behavior? In this case, mental health problems. So I've spent the last few years reviewing what activities are there outside of psychology in everyday life that make a difference in mental health problems. Perhaps those will be more easily disseminated. And I just finished a book on this topic. And here's what we know. There are all sorts of things in everyday life that the government and mental health people should be promoting because they have huge impact on mental health problems. Physical activity and exercise, Physical activity and exercise shows evidence that it can reduce depression and anxiety and other disorders. Well, people are going to do a little more of that, maybe because there's not as much stigma there. And the benefit of exercise and physical activity is that it changes physical health. As you know, people with a mental disorder tend to die earlier than expected. And they tend to use emergency rooms more. And they have higher rates of cancer and heart disease and respiratory diseases. So something like exercise would be wonderful because it not only improves mental health, but it improves physical health as well. What else? Volunteering. When people volunteer, that's just not a nice thing to do. It reduces symptoms of mental disorders. Isn't that incredible? We could encourage volunteering. Many people volunteer already, but if we can increase just a little bit more, that will be huge in helping mental health. Now, if someone's suicidal, they're on a bridge and they're ready to dive off, is exercise or volunteering going to help? Of course not. But at the same time, we want to focus on prevention and people who have the problems now that aren't so grave that they need to be on heavy medication. Having hobbies. Having hobbies makes a difference. The research shows that it does. Tai Chi, Qigong, yoga. Yoga. 12% of the population use yoga. Look at it to 20%. Why? Am I making money if people use yoga? I'm not making money on anything. But yoga reduces symptoms of mental disorder, not just make the person feel better. They do that. Or improve quality of life. It does that. Or to give people a sense of well-being. It does that. That's not my interest. My interest is what can be done. So in the future, I'm hoping to promote activities that aren't traditional psychotherapy, but can improve mental health. That's my focus now.
Thanks. Before moving to our last question, I want to congratulate you because you will certainly make a great contribution as you have been doing all this time. I will also be posting updates on social media about your next book. Finally, as an expert with decades of experience, what advice would you like to share with the students and emerging professionals in psychology who seek to advance their careers and contribute to the field?
So my bias, let me start with my bias. Please join the group in helping overcome the problems of mental illness. They're serious, they're expensive, they hurt individuals and families. So join that issue. But if that doesn't attract you, choose a problem in the world that you care about. There's so many, you'll have no trouble finding one. And now learn all you can about it, work with people, find a mentor who's working on that problem and work with her or him. Get involved in a project, a little project. Learn more about it and make sure you feel you're working on something important. It's important to have that feeling that what you're doing is important. Will you have impact? It's hard to judge, but make sure you feel it's important and you're working on it. And be involved with others of the same kind. And it's most important to work on a significant problem. Your career, that's secondary. You'll get there. But work on something that you really care about and makes a difference. And that's all I really have in the way of advice.
Personally, I take your advice with much affection and admiration for your entire professional journey. Thank you very much, Dr. Kazdin, for sharing your time, wisdom, and experiences with us today. It has been an honor to hear about your incredible career, your valuable contributions to child psychology, and your ideas for the future of this field. I'm sure that this interview will inspire many parents, professionals, and students. And I will also attach resources for parents, educators, and professionals that you and your colleagues have developed in the description. And this recording will be available soon and on the polyglot for everyone to benefit from your knowledge. I wish you the best in the future projects, and I really hope we can collaborate again, Dr. Kazdin.
Thank you so much for inviting me. It was a pleasure.